relevance and we'd love to learn more what we can do when we are all working remotely and how to really use the technology as well as the expertise in the field, how to really enrich the kids' learning, and especially we are looking very diverse community, right? So, and we have to really understand the needs from the community and empower them to really promote their own futures and their own cultures. So I would really want to thank Professor for giving this talk and your graduate student. Thank you.
Great, thank you. I guess I can go ahead and get started. So I'm going to be talking a little bit about some challenges that we've been having in terms of doing language assessment in the current situation where we can't actually interact with children in a face-to-face kind of a setting. As many of you know, these are some of the languages spoken all over the world. And these languages are represented in California as well. And so I like to think of California as being kind of this microcosm of the languages that are spoken in the world. So I know there's probably in this session a lot of students who speak languages other than English. I'm one of those kids who grew up with immigrant parents who spoke Spanish at home until I was about 5 years old, and then I went off to kindergarten, and my mom says that we learned English together. And this English language learning population represents about 20% of the US child population all over the country. In California, it represents about 40% of the population. So 2 out of every 5 children that you run across speaks a language other than English at home. And these kids, I see these kids as a real untapped resource that we have, and we don't know really that much about bilingualism, but there is some history. In, I think, 1998, I actually have it in my notes, I just need to read them. In 1998, bilingual education was outlawed in California under Proposition 227. So all classes were forced to be given in English in the public school setting. And the push was to learn English by making it by maximizing time in English so that it would be a more efficient learning. But one of the problems was that it didn't take into consideration that maybe bilingualism or knowing another language is not a disadvantage and could actually be an advantage. Around 1998, I was a professor at University of Texas. I started there in 1995. And soon after, I'm from California, and soon after I left California and went to Texas, this Prop 227 came into play. Almost 25 years later, I came back. I've been here at UCI for 3 years now. And just as I was coming back, Proposition 58 outlawed Prop 227, which brought in bilingual education back into California. So it's been fun to like leave as it, English only kind of came into play, and then come back as the benefits of bilingualism are being more and more recognized. And I think there's a lot of different kinds of advantages to being bilingual. There's certainly evolutionary kinds of advantages where knowing more than one language gives you more opportunities for exchange. There are advantages that are economic. So Switzerland, for example, attributes 10% of its gross domestic product to its multilingual heritage. And other countries that can't interact in more than one language tend to lose out on some of the economic advantages that bilingualism can give you. There are also some noted cognitive advantages. So bilingualism could stave off diseases like Alzheimer's. Not that it staves off the disease, but that the manifestations of the disease are put off a little bit later. And then there's some benefits, of course, in the social domain. So these are the kinds of things that I think about as I think about language impairment in this bilingual context. I'm a speech language pathologist by training, and I worked clinically for a number of years before I went back for my PhD. And in that position, I was always asked to think about and to do assessment of children who might have developmental language disorder. So what is this? I think probably everybody knows what autism is or has heard of it. A lot of people probably also have heard of dyslexia. Developmental language disorder is a disability of childhood that affects language, but most people have never heard of it. What's interesting is that it's one of the most common childhood disabilities. So it's often invisible. These kids are often identified as having, low motivation, or they're lazy, or they don't pay attention, or they have bad memory, but it could be masking a developmental language disability. And this is a disability that affects phonology, so the sounds of a language, the grammatical features of the language, vocabulary, as well as social skills. And in terms of phonology, I said that these kids might make sound errors in grammar. They might make omissions of like past tense ed, or the plural s marker, or the ing marker. They might use fewer words, and they have difficulty with perspective taking. So this is a big challenge to identify and to serve these kids in the public school setting. So this is one of the working definitions of DLD, that it's a language disorder that delays the mastery of language skills in children that don't have hearing loss. They don't have any other developmental delays. We also have this large bilingual population. And so what does bilingual DLD look like? Well, it's the same thing, but there's a couple of different conditions. So one is that these kids shouldn't be identified as having DLD if it's an effective second language acquisition. So while children are still in the process of learning English, they don't have a disability, they just don't know English yet. And a DLD should affect both of their languages. So this has been, this was a lot of my early career in trying to figure out what's a disability, what's a true delay in this bilingual population that is growing. And just to give you an example, once, and this was about 30 years ago, I was called to do consultation in a school district where they had identified every single one of their Spanish-speaking kindergartners with a developmental language disability. And the school district said, this can't be possible, right? And so they asked me to come in and reevaluate all of these kids. And so how do we make this determination? So a lot of my work has been in looking development of measures that do a good job in differentiating DLD from typical development in a bilingual child. Now, this is a general issue in the field because we have a lot of tests that are out there. Most of them, unfortunately, don't work. So there was a 2006 study that was published that reviewed 43 of the tests that we use in our field to identify DLD. Only 5 of them had good sensitivity and good specificity. So over here, this purple, let me see if I can grab that marker. This purple area here, we want to have a test actually do what it's supposed to do. We want to identify children with true DLD, and we want the test to not identify or to say that this kid doesn't have a DLD when they don't. So we want tests to have high sensitivity and high specificity. In the field, we consider, a fair test if it's got 80% accuracy. A good test should have 90% accuracy. Of the 43 tests that were reviewed in 2006, only 5 of them met that criteria of 80 or 90% accurate. So that's not very good. Fast forward to, there was a more recent paper done, I think it's 2011 or 2018. And I think we've made some progress. More test developers are publishing their sensitivity and specificity results, but only 8 now meet this criteria. So we don't have very many really good measures to work from. So when you're dealing with kids who speak English as a second language, that number goes even lower. And so that's been part of what I've worked on over the last few years. So we have few bilingual SLPs, about 94% of speech pathologists, and there's about 150,000 in the country, know another language. That's not very many. And then we've got 20 to 40% of kids who are bilingual. So we've got a big child population and a few people who can address their needs. And so the risk for misdiagnosis is really high. So we had proposed an NIH study that was funded to develop a measure that we're calling the TEL, the Test of English Language Learning. And our idea was that we would develop a test where we would test kids in English so that we could address the needs of our 96% of monolingual SLPs, where they could test in English and still tell the difference between children with and without language impairment based on how much exposure children had had to English. We had proposed to use as our reference measures or our comparison measures a test that we developed under another NIH project called the BESA, the Bilingual English-Spanish Assessment, the MAIN, the DELV, and a monomorphemic task. I'm going to tell you a little bit more about these. So the BESA is a test that we published a couple of years ago. I think it's 2018 that this test was published. It has 90% sensitivity, 94% specificity. So it actually does the job of identifying kids with impairment and ruling out kids who don't have impairment when we use a combination in their best language. So maybe kids do one thing better in Spanish and do something else better in English. And if we combine those two together, we get a really good sensitivity and specificity. I'll show you one of the tasks that we use. So here we say something like, this is a girl and this is her umbrella. This is the girl's umbrella. Here's the clown, and this is the, and kids finish that sentence and they say clown's umbrella. And so what we want to hear is that final possessive S. Children that have developmental language disabilities have difficulties putting that in. Either they don't know the rule or they don't hear it, or something's going on in their linguistic grammatical system where they can't produce these grammatical markers. So that's one part of this new study that we're doing. So this is the measure that we already have that we know works, and then we're going to develop a new measure and test it against the old measure to see if our new measure can work for English speaking kids. Now, one of the problems that we have is it could be that kids don't know the sound system. So maybe they don't put in that final S because they can't say S, or maybe they don't do it because they can't produce that possessive marker. So we look at things, what's called a monomorphemic task like bed, and the final D sound in bed is the same sound that we might see in a past tense, right? Boiled, right? Or house, we see that in the plural books. So is it that they can't say the sound, or is it that they can't produce the marker? So we're trying to make that distinction in our study. Another thing that we're doing in our study as a reference measure is we're asking kids to tell stories. So children with language impairment or with developmental language disability tell really general stories, and they don't necessarily put in all the details, and their story comprehension tends to be pretty poor. So they don't understand all the elements or who did what to whom. So we're using the multilingual assessment for instrument for narratives, also the main, to determine whether children have or don't have language impairment in order to test our new test. And then the final measure that we had proposed to use was the DELV, the Diagnostic Evaluation of Language Variation. And here we know that children who have exposure to different versions or varieties of English may show different dialect variation. So we want to know what dialect kids are using and how dense that dialect is so that we can make an appropriate clinical decision. So what's the current challenge? So right now, school districts have said, well, you know, all these kids are at home. They may have disabilities, but we can't do any testing because we don't know if these measures that were developed for face-to-face testing will work. The problem with that is that the Individual with Disabilities Education Act requires eligibility assessment to be completed within 60 days of referral. Right now, many school districts across the country have suspended much of the eligibility testing, and they're moving more and more into lack of compliance in terms of what the law says that they should be doing. The other challenge is with kids who speak English as a second language, there's already a documented 1-year delay in identification. Lots of times people say, well, let's wait till they learn English, or there's nobody in this district who speaks their home language. We can't possibly test them, so let's wait. And we don't want to make it worse, because if children need the intervention, earlier intervention helps to close the gap. So these are some current challenges that we're seeing. And of course, in our own study, we've been totally delayed with this new project because we can't get a hold of kids because we can't test them in a live setting. So people in my field have said, well, maybe what we need to do is renorm. Well, renorming is ridiculous, I think. And I wrote a blog, I have a blog called 2 Languages, 2 Worlds that I talk about these kinds of things, and I rant and rave about, you know, my field. And it's just not feasible. One, it's expensive. So it costs our grant for developing the BESA was about a $5 million NIH contract. It's not feasible for test developers to just go and develop a new test or renorm a test. It takes a lot of time. It's very expensive to do. What we're proposing is an equivalent study. So if we can demonstrate that online assessment is as good as face-to-face assessment, then I think we can move forward with our own study, and we can also provide some important information to the field that will make people feel a little bit more comfortable using standardized tests in say a Zoom environment or something like that. So our what we're proposing is an equivalent study to test out the validity and reliability of the measures that we had proposed to use. So our validity question is, are we testing what we think we're testing? And you can imagine that for the kinds of things that we're testing whether kids can produce the final ends of words. Those are really hard to perceive in an online environment. We're asking kids, little kids between 4 and 8 years old, to look at pictures and tell us a story. Are their stories going to be as good if they do it from a screen in a remote situation versus sitting next to them face to face where you're looking at the pictures together? So those are really practical questions. And then the other part of this is what we get accurate? Is it easy, or is it can we achieve good reliability between somebody testing a kid face-to-face and somebody observing and testing them in a Zoom condition or an online kind of condition? Okay, I'm like, this says the same thing, but it doesn't. And some of the situations that could come up up is kids might be unfamiliar with an online format. Household members may interfere with responses. So sometimes we have parents jumping in and telling kids what the answers are. We want to know what the kid says, not what the parents think the answer is. And again, are the test data accurate? There are things like sound quality, scoring accuracy are going to come into play. So basically in the study we're working on this summer, we are comparing online and face-to-face administration of these measures, the BESA, the DELF, the MAIN, and this monomorphemic task. Previous studies show that there's equivalence for language sampling, for the clinical evaluation of language fundamentals, and for the test of integrated language and literacy skills. But very few tests of, say, in our field, we had 43 in 2006, maybe we have 50 measures now that people are using. This is only 3 of the kinds of measures that we might use that have been validated for this purpose. So this is something that we really felt we needed to do. And we did it in a couple of ways. One, we made different versions of things. So we don't want to test every kid twice on everything, because that would be a tremendous amount of time and kids would get bored. They'll know that, well, you already asked me that question, why are you asking me that again? So what we did is we developed a version A and a version B of each of the measures, and we split them by odds and evens, or the monomorphemic task is only 10 words, so we are giving that twice, but we reorganized the order of items. The BESA, we split up by type. So we have items that are plural items, we have items that are past tense items, we have plural items that are ing, present progressive items. And so we're splitting them by type with some items that are repeated across the 2 conditions. And we're going to compare whether version A, given either online or face-to-face, is the same or gets us the same results or consistent results with version B given in the opposite condition. Our participants, so who's going to do this face-to-face testing, right? So our participants are caregivers who are SLPs who are in the target age range. So, we're basically, for this pilot, we're asking our friends, we're asking our friends' friends, and so on. So it's like a snowball sampling approach. If they would have a kid in the target age range, if they would be willing to do our task, and we would do it in both conditions, where the parents, the mom or dad, will, or actually in some cases siblings, will give the test to their child in the online condition, like from another room, and in the face-to-face condition. And we're asking questions like, can the can a 4-year-old use the mouse reliably to pick the right picture? What kind of equipment does this work on? Are we going to do it on an iPad? Are we going to do it on a computer? We're we're taking into consideration things like, if we put a headset on a kid, will that lower the chances that another parent might interfere with the testing, or another sibling might interfere with the testing because they know what the answer is and they yell it out? And then we're also looking at the reliability between whether the SLP parent and the researcher scoring is consistent. So we're addressing these issues of reliability and validity. We've done 2 cases so far. Well, actually now I think we've done 3 or 4 cases, and we've had to think about how long does this take. So far it's taking about an hour and a half total, so we're doing 3 30-minute sessions. We're thinking through what the instructions to the caregiver should be. So is this possible to do? Yeah, it's possible to do, but what about the users? How are they gonna view this? How are kids gonna view this? Will we get the information that we need from doing this kind of testing in this way. We are also trying to consider breaking up the kinds of sessions that we're doing. So we do an interview. So some of that interview we can do on the phone if people prefer to be on the phone over Zoom, especially parents who may be on Zoom at work all day already. So those are the kinds of things that we're starting to think about. So I just wanted to give you a quick overview of the broad project and then this very specific summer project that we're doing. And it's been a really fun collaboration because we have to consider, you know, SLPs, but we've had to also work with people in other fields to be able to, you know, because I'm not trained in this stuff, right? I'm trained in like how to do a test, how to do, you know, item response theory, that kind of stuff, linguistics. But you know, like these kinds of issues to consider about, well, what about parents and what about kids and how well will they perform in this Zoom environment, and how does the acoustics of what we're trying to look at affect what we're doing, are all questions that that we're working on together. And it's a group of undergrads, graduate students, postdocs, and faculty all working on this project together. So it's been really fun. And I'm hoping that we can end up with something that's going to be usable for clinicians in my field. So if you have any questions, here's my contact information, and I'd be happy to take questions or discussion or whatever y'all have.
Professor Pena, thank you so much for your wonderful talk. Can you hear me? Yes?
Yes, I can.
If I may ask everyone to turn your videos on, and maybe if you can stop sharing, Professor Pena, so we can.
Yeah, okay. There we go.
So good afternoon, everyone. How's everyone doing? Good?
Doing good.
Good, good. So what you saw is a beautiful example of the great work that Professor Pena and her colleagues are doing, applying social behavior methods, social sciences research methods. So I like Darwin with his mask. I'm going to start with Darwin. So what do you appreciate the most about the social science research method and the approach?
The research method?
Right.
Well, I am also doing research in testing and diagnostic testing, but not necessarily for language. It's for medical purposes, or I would say like electrochemical detection or the virus itself. So actually I had a question about how you guys determine sensitivity and specificity, because that is something that I'm familiar with. But I have a question about like, how do you guys determine whether a kid does have DLD? Like, what does sensitivity actually mean, like in you guys' context?
Mm-hmm. That's a great question. So sensitivity is, you know, if a kid really has language impairment, right, or DLD. And so you have to use a really good gold standard. The problem, of course, with bilingualism is that we don't have a great gold standard. So I always say, well, we have kind of maybe a tarnished silver standard. That we use converging data to determine whether a child has DLD, and that is our reference measure. So our reference measure for this new test that we're developing is going to be a combination of their language sample performance, so the storytelling in both of their languages. So we're going to have kids who speak Vietnamese and English, or Spanish and English, and so we test them in both of their languages. We're going to look at their grammatical production in both of their languages, their storytelling abilities in both of their languages, and then we're going to ask parents and teachers to fill out a questionnaire about their use of grammar, vocabulary, stories, comprehension, and one other thing that I can never remember, sentence length. And those are all indicators of DLD. So we're using those 4 different sources of information in a converging way. And that's going to be our reference standard. And then we test our new measure, so our index measure, against that reference standard to determine how well that matches. And so that matching of the index and reference measures in terms of identification of DLD is our sensitivity, and then the matching of not having language impairment on both of those is our specificity.
Okay. And so is it correct to say that sensitivity in this context is how bad a child has DLD, like how severe it is? Is that correct?
Yeah, it's not a measure of severity. It's a yes/no binary decision.
Oh, okay.
Yeah, so we set a cutoff and say if they meet, in this case, what we're doing is we're saying if they meet, we already know what cutoffs are for these different for the 4 reference measures. And so if they meet criteria on 2 of the 4 measures, then we classify them as DLD.
Okay. And what about specificity?
Yeah, specificity is the opposite of that. So specificity would be if they show that they don't have language impairment. So if they're above the cutoff on 3 or more of the measures, then they don't have language impairment. And so what we're doing is looking at the percentage agreement there.
Okay.
Yeah. Does that make sense?
Kind of, yeah.
There's a matrix, and in the medical literature, there's a lot of like online calculators for determining sensitivity and specificity. So you can just put in how your index measure and your reference measure and what the counts are for each of those, and it'll calculate it for you.
Yeah.
Or you can calculate it by hand. It's pretty simple, straightforward math.
Yeah, yeah. I'm familiar with the formula. I wanted to kind of connect the 2 together as far as like what contributes to specificity.
Oh, right. So yeah, that's just the agreement with not having language, with each of the agreement between the 2 measures indicating that there is no language impairment.
Okay.
And you want both of those to be high, right? Because what happens is if you have high sensitivity but low specificity, you're over-identifying, right? Or if you have high specificity but low sensitivity, then you're under-identifying. And so you want to have both of those be pretty high. So we're aiming for 90%. But 80% will do the job, but 100% is best.
Okay.
Darwin, these are really great questions. Follow up from the rest. So if I were going to ask Melinda, what does snowballing mean?
I'm really glad
Melinda, I can't hear you. Your voice is not coming through.
Nope.
Nope. We'll come back to you. Would anybody else like to take that question? What does snowballing mean? Or would you like to know?
I mean, like in the general sense, snowballing is like when you don't address something early, it just gets worse and worse over time. So it's like, that's the metaphor, right? You have a snowball rolling down a hill, it'll just pick up more snow. So if you want to stop it, you got to stop it early.
That's from a technical term, but in this context,
yeah. In this context, so it's like a snowball sample. What is a snowball sample? Is that what you're asking?
Yeah, that's exactly what I'm asking.
Then I might have spoken bad.
You're on the right track, right? But we're using it in a positive sense. We are getting more participants this way, right? So we ask one person and we say, do you have anybody else you can refer to us? Do you have any friends who are speech pathologists who have kids the same age?
Okay, so in a way it's compounding. You're compounding more or referring more people, more connections. Is that what you mean by that?
Yep. Yeah. So that's considered snowball sampling. And you keep going until you kind of saturate your snowball, so you get as many participants as you can. Because for this pilot, we're looking for very specific people, speech pathologists who have kids in this age. So they probably, so it's like SLPs who work in a school district might know other SLPs who have kids in that same age range. And so we want them to refer their friends. So that's a quick way of doing this just for the pilot.
So I didn't mean to jump directly into key terms and definitions, but I just wanted everyone to really appreciate the wonderful, social science research methods and some of the key terms and definitions. So let's open up for more questions. Based on what you heard, what some of the questions that resonated with you, you would like to inquire about? This is a golden opportunity for you, so please ask. And Angelo, I don't know if you're with us, Shuyang.
Oh yeah, hi.
So you might want to turn your camera on if you're comfortable with that. If you're not,
Okay.
Yeah. And the same for the rest of you if you're comfortable with that. So Angelo, any questions? John, Jackson, Vikram,
I have a question I can ask if that'd be okay.
sure. But before that, Melinda, I'm sorry about your mic is not working, but feel free to post your question on chat if you want, if you have a question. Yeah, go ahead, please.
So I did a tiny bit of research, and I just saw like on a website they talked about that some of the interventions for DLD can be done like from a parent or by a caregiver with the supervision of like a speech language therapist. Mm-hmm. So just interested in whether there have been thoughts about either existing tests or possible tests that could be done by parents or caregivers just in person remotely, that under the supervision, whether it could possibly still have the same validity, or if there's just difficulty in training parents to be able to like properly give those tests.
Yeah, that's a great question. And I don't know. Parents are great at, if you ask the right questions, they can answer, they can give you really important information. So one of the things that we did early on is we used to, parents usually know if their kid has a DLD, they usually know. They may not know what it's called, but they know that something's going on. So we used to ask families questions like, so are you concerned about their language development? Are you concerned about their sound development? Are you concerned about their speech? And parents would say, oh yes, I'm concerned because blah, blah, blah. And so they would say, oh, their language was delayed, or they don't use full sentences, or my child is, is rude to his grandparents. He's not very polite. So we would get all kinds of answers. So some of those are real concerns that might indicate DLD, like late to talk, but not being polite. It might be rude, but it's probably not a DLD. So so when we started asking more pointed questions like, can you tell me on average, how long your child's sentences are? Parents could tell you that, and then you can do the interpretation of whether or not that's an issue for that age, right? We can ask parents, can they pronounce these sounds in speech? And if you know that what 4-year-olds can do and what 5-year-olds can do, you would know if that signals a problem. We can ask parents, does your child use, past tense like drop, dropped? Do they make that distinction? We can ask them those kinds of questions. And when we ask those really precise questions, we get very accurate results. And those are indicators of DLD. The testing, I think, would be a little bit harder to do. Usually they're very, expensive tests. Parents aren't going to have access to them. They're not online, so they're, harder to access. So I think that might be tougher, but certainly asking good questions, and there's some really good validated questionnaires that you could work with parents. But yeah, that's a really good point. I mean, I think that we can do parent based intervention that is maybe directed by an SLP, and I think that that's super effective. We haven't solved this assessment question very well.
Okay, thank you.
Thank you.
Allow me to ask a question, and it's related to the personal situation. I don't want to get into details of that, but so you mentioned earlier that sometimes when there are multiple factors or multiple delays, developmental delays, this study might not be, or the approach might change, or So in the case of when you have these devices that like an iPad and the child is relying more on verbalizing through the device, which one will have a better impact in terms of developmental progress? To rely more on the device or to rely more on the speech pathologist and I understand there's a whole technique with jaw movement and what sounds they make. And
Yeah, that's an interesting question. It probably depends on the nature of the disability and what the needs are, right? So Yao has expertise in this area, right? And so I think that I think it really depends. If kids need more social interaction, then I think social interaction should be the medium by which intervention is delivered. But some of these devices can be really effective in supporting that interaction. So I'm always of two minds. I remember being on, some of these panels to evaluate grant proposals, and we can do a lot more with technology than we used to be able to do, but is that the best way to learn to communicate? Communicating with devices or communicating with people? Because we communicate to communicate with people is the bottom line. So I always kind of go back and forth with, ultimately I want kids to be able to communicate their needs with other people, even though I think some of these like conversational agents can be used to practice.
And allow me to share with you a question from Melinda, whose mic is not working, asking, she would like to know how children are brought to be tested for DLD. Are they recommended by their parents or teacher?
Yes, they are usually recommended by their parents or by their teachers. And what's interesting, it brings up a really important issue that a lot of these kids are missed. So there was an epidemiological study done about 25 or more years ago, about 50% of children with DLD are missed in public schools. The other thing that happens is boys, for a long time in the field, we thought that boys outnumbered girls 2-to-1 because of caseloads. And it actually turns out from, one of the outcomes of this EPI study was, and what they did is they tested every kid in Iowa. So like we tested, every kindergartner, I think, in Iowa. So they tested like 10 or 13,000 kids, and like, not every kid in Iowa, but they tested a bunch of kids in this prospective study. And they actually found that the ratio is 1.2-to-1 boys to girls. So boys have a slightly higher elevated risk for DLD, but it's not 2-to-1. But on caseloads, there's 2 boys for every 1 girl. And I wonder if kids are overlooked, if girls are overlooked, if they're quiet and compliant. And boys are referred because they act out in class, so the reaction, to having difficulty with communication may be manifested differently by sex. And so then, you know, kids who act out are more likely to be referred than girls who don't act out, even though they're quiet and may be also struggling with language impairment. I think screening is the way to go, but schools don't necessarily screen. So it's a challenge, yeah. Usually teacher parent report.
Please, I want to invite the fellows and any other questions.
I guess I haven't like more of like I guess I was like really surprised that these issues like with speech is more common than you think. I just like wanted to point that out. I guess like I thought it was really insightful because I think just as a past like I've interned somewhere where they weren't sure with like how to design certain material, and they only wanted to do like in English. And I remember thinking like, well, I know like where I went to elementary school, there's a lot of kids with like Spanish, like who only preferred Spanish speaking or preferred like to speak in Spanish. So I would like thought that was like kind of like a disadvantage to them in terms of like being able to access those resources. So I guess not like a really question, but I thought that was, yeah, like insightful. But thank you so much for sharing like your research and your experiences.
Thank you. Yes.
Any more questions from anyone else? Professor Pena, concluding remarks by you as we look into the future. Some advice for all of us, words of wisdom.
Words of wisdom. You know, you guys are the future, and you know, I've been doing this for, I hate to say I've been doing this for almost 30 years, and it's a lot of fun. I am still loving doing what I'm doing. And the funnest part for me is doing this with you guys, and to working, you know, like working with students is why I keep doing this, and working with like kids in schools is the other reason I keep doing this. So find a problem, try to solve it, and do it a lot and do it well. I think that's basically my advice to all of you. And, you know, congratulations on, you know, working on all your projects over the summer. They sound super exciting and really fun.
Again, our gratitude. Please let's give our thanks to Professor Pena. Yeah. Thank you very much. I'm going to turn it over to Professor G.P. Lee and Sonia, if there's anything you want to add.
Yeah, I want to really thank Professor for an excellent talk. I enjoy it very much and learn so much. I do have a question is when you talk about bilingual kids, and currently there are companies I know of working on the speech or the voice recognition system like Alexa.
Mm-hmm.
What they could do is to do translation directly in real time with 20 language. Would this kind of platform be useful for you when you are dealing with a remote? In case the kids is a lot of English language ability, but they would understand their native language in a way to lower the barrier for the interaction. Would that be helpful to you?
Some aspects of it would be. So one of the things that is a challenge though is that the markers of language impairment are different in different languages. So right. For example, you know, in English, it's like the markers at the ends of verbs that seem to indicate that there's language impairment, and probably because they're low signal, right? So, you know, they're short in duration. Acoustically, they're really weak syllables in the acoustic sound stream. And so that's one theory as to why these kids have difficulty producing these sounds, that there's something in like processing going on. But in Spanish, for example, the grammatical system is really robust, and it's complex, but it's acoustically complete. And so what children have difficulty there is in a different part of the speech stream. So, it wouldn't work well, that part of it wouldn't work well in translation, but I think certainly speech recognition could help us to get at that. I actually have a doctoral student who's working on whether or not something like Alexa could do accurate enough transcription to make these kinds of decisions. And one of the questions is, how much of a sample do you need in order to, for Alexa to reliably transcribe it? So like single words are almost too short, right? And then, but then narratives are almost too long. So we have to find the right place. But that's a really good question. That's probably not a question that I'll answer in my career, but certainly my doctoral students are gonna to answer these questions. Yeah.
Thank you.
Thank you.
Back to you, Sonia.
Unmute yourself.
You're muted, Sonia.
There we go. I'm happy everyone is well and was able to attend today's seminar. I encourage you to log on Tuesday of next week, and also wanted to remind you that we have on August 6th, which is Thursday of next week, we'll have a mid-program check-in where we will be asking each of our fellows to develop some, about a handful of slides, about 5 slides, just to talk about a little bit about their experience and what they are working on. In particular, just give a brief introduction, why society should care about what you are working on and the project that you've chosen. What have you accomplished thus far in the few weeks that you've been in the program? And how do you see the development of this program affecting possible for future work? So keep in mind the rule of 5s, make it 5 slides, 5 bullets, 5 words per bullet, and talk more to it. And it'll be pretty much like a mid-term rehearsal for the final symposium that we have scheduled in September. So you still have plenty of time to practice, but we want to just check in with you to see how things are going and make sure that we can make some adjustments if need be. But I'm sure everyone is doing fantastic. And that's all I have.
Thank you so much, Sonia. Again, our gratitude for Professor Pena. Thank you all for attending, and to the Cal IT2 team for everything you're doing. We wish you well, and we will see you next week. Take care.
Thank you.
Thank you. Take care.
Bye.
Thank you.
Bye.
Bye.